Hey, Mulvanaka, and welcome to another episode of Health Talk with Oceania Hospitals, our 21st episode, and this is a very special episode. For the past 20 episodes, all we have been doing is we basically introduced, right? We've been doing introductions of our specialists, of our staffs, of our GPs, and basically the entire hospital. Now we're diving in depth, right? And what a better way to start this off than our very own dermatologist here at Oceania Hospitals, Dr. Harish. Doc, welcome to the show. How are you?
Alex, and thank you for hosting me this again the second podcast. The first was very successful, and it got a very good feedback from the public.
Thank you. And for those of that have been following our social media pages, Dr. Harish is currently on an outreach roadshow program, and we've basically covered the West, and this week is currently in the North, and let's dive right into it. We're just going to dive in depth, and we're going to start with one of the most common calls that you probably get is chemical peels, right? Could you just walk us through the key benefits of chemical peels and how they contribute to overall skin rejuvenation and acne scar treatment?
Yes, Alex. As we have discussed with our team, the main theme of this podcast is to create awareness among the public regarding the dermatological procedures which we have been doing in Fiji. So past 1 year I've been practicing here, and past few months we have been actively doing all kind of skin procedures, among which chemical peels has got a good feedback from the patients. And chemical peels basically is a in-office procedure where the patient expects some change in his skin pigmentation, texture, overall radiance of the skin. So the chemical peels offer very quick benefits in short sessions, and it is very convenient for the patient. He can come on the same day, he can just get the procedure done within half an hour, and he can just carry on with his activities. So basically chemical peel involves exfoliation of the skin where the dead skin layers of the skin are exfoliated, and it also involves intense hydration of the deeper layers of the skin. Also it promotes radiance by dealing with the pigmentation. So that's how chemical peel offers all kind of instant benefits. It is done usually in sessions of half an hour each, and the spacing is usually 10 days to 15 days depending on the condition which they offer. So there are various strengths, whether it be medium peel, deep peel, or superficial peel. So depending on the indication, whether it be for the acne or whether it be the scars, pigmentation, especially the melasma, or what you call the parchai or chaya in Fiji Hindi. So these conditions are usually dealt for chemical peels. So yes, we are doing quite a good number of patients, and they are giving good feedback on this procedure.
Thank you. And then still on the topic, skin cancer screening. Cancer screening. I know it's a pretty broad topic, and if we can just dive into the nitty-gritty details of what's just the important parts, like why is regular skin cancer screening so critical, and what should patients know about early detection and prevention?
Yes. So yes, in Fiji I encounter multi-ethnic group of patients. So you might be wondering why we are throughout our childhood we are exposed to the sun, and why we should be concerned about skin cancer screening. But in few skin type individuals, especially type 1, type 2, very fair skin, and they usually get tan, and sometimes sunburn also is very common among them. They are very prone to skin cancers, especially of certain ethnic races, especially from certain continents like Australia and these countries. Usually they have the family history of skin cancers. So it is very important to screen such patients, because 1 in 5 patients above 70 years are prone to develop skin cancer. So you can imagine the burden of it. So in US usually per day 9,500 cases were detected. So this is a case detection rate. So that's how the skin cancer screening becomes a very important part of our dermatological examination here. So we do employ various techniques like physical examination as well as dermoscopic examination, where we find certain skin characters. Especially we follow the basic rule, the ABCDE rule, and where we evaluate the asymmetry of the lesion and borders of the lesion, whether they are irregular borders or not, and color wise and diameter more than 6 mm we suspect, and especially evolution. So how fast is it evolving, and also the family history and feeling of any abnormal sensations, especially itch, irritation. These are all the triggers and identification factors. So the patient, we also encourage the patients to check themselves thoroughly, and also we advise every 6 months checkup by a dermatologist where we find some abnormal lesions, especially in very less accessible areas like scalp, between the toes, under the feet, under the nails. So these are all the common areas which we miss. So we take care of those unidentified areas as well, and try to advise the patients for the biopsies and to get early detection. Early detection matters the most, because if the patient misses the golden time period, then almost the lesion is inside your body. So the treatment becomes difficult. But overall, early detection offers a very good prognosis. Yeah, in that way, I encourage patients to check for the moles, and please follow with us, and also we'll be helping you with all the kind of diagnostics.
Thank you, Doc. And also on that psoriasis evaluation, how do you, as a dermatologist, assess the severity of psoriasis, and what are the typical treatment paths based on evaluation findings?
Hope, Alex, you might have remember we discussed some autoimmune conditions in previous podcast.
Yes.
So the two common autoimmune conditions I encounter in parts of Fiji, especially from the west and the north, is one among which is psoriasis. So here I found this condition among all age groups, including the school going, the middle age, and the elderly people as well. So different people present with different symptoms, and we need to evaluate the triggers for them. We need to evaluate the area of involvement especially. So in childhood, the triggers might be emotional, most probably, and also the family history. If one of the parents has it, the child develops it. Almost 4% of transmission, including the vitiligo as well. So coming to psoriasis as such, we need to identify what triggers it especially, and also the area of involvement. If it is less than 3%, we get categorized as mild, 3 to 10 as moderate, and more than 10 as severe, more than 30 as severe. So 10 to 30 can be considered as moderate, where we get most of the patients in this category. So mild category, we usually treat with topical creams like steroids and emollients, whereas moderate classified people will treat with combination treatments. We involve ultraviolet therapy as well. We are trying to procure the UVB therapy as well, and also the severe cases we do try some injectables and advanced treatments. So psoriasis as such involves intense scaling, inflammation, and a lot of itching sensations as well. So we try to identify which stage it is and how severe it is, and depending on that we plan our treatments.
Thank you. Just last question, eczema evaluation. What does an eczema assessment usually involve? And how does understanding a patient's triggers lead to more effective personalized treatment?
Yes. So eczema is also a part of a condition where we assess all kind of triggers especially. So we do ask multiple questions. So in what conditions this eczema getting triggered, in what environmental conditions, emotional conditions, whether it be related to the food or whether it be related to the previous family histories. So we need to evaluate thoroughly, and we are performing certain allergy panel tests which helps the patient to identify his triggers. As soon as we get to know basic idea about the triggers, we tailor our treatment accordingly. So basically we advise the patient how to manage with those triggers, and how to follow the regular treatments, usage of skin barrier repair creams, and protection from UV light. So whatever is a trigger, they need to be careful about. So successfully we are treating multiple eczema cases here. So especially in chemical induced and sun induced eczemas also.
Thank you very much, Doctor. And for those of you who are watching and have been following our social media pages, you would have noticed that Dr. Harish has been traveling around the country, and we've done hit the Central Eastern Division, and we've completed the West, and now we're currently in the North right now. And thank you very much for all the support, and thank you very much for coming in. So until next time, from our team here at Health Talk with Oceania Hospitals, Vinaka Vakalevu.
Vinaka Vakalevu. Thank you.